The focus of my research is all about psychological flexibility. So psychological flexibility is the capacity that we each have to show up in our lives, to be aware of whatever's pushing us around, whether that's environmental circumstances or internal circumstances, difficult feelings, thoughts, beliefs, etc. To be open to those things and to then choose to take actions towards the things in our lives that we most dearly care about. When someone is able to do that with openness, awareness and engagement in life, we call that psychological flexibility. And we've used this framework as a way of understanding how people respond to a range of different adversities in life, most particularly in relation to persistent health problems. So some of our work has looked at chronic pain, some of it at irritable bowel syndrome, and more recently we've started getting into working with cancer and different stages of the cancer journey. So the goals of this program of research are the prediction and influence of behavior. So what I mean by prediction is using some of these measures of psychological flexibility to explore whether that's a useful way of understanding how people struggle with adversity, whatever it happens to be, at different stages of a particular chronic illness, for example. But we're not interested only in prediction, we're also interested in influence. And so we want to then translate some of those findings from prediction into, well, how do we do interventions that will actually improve people's ability to deal effectively with a range of different kind of circumstances. One of the most exciting programs that we're currently working on is a Macmillan-funded project jointly run between ourselves here at the University of Edinburgh, the University of Chester and Marie Curie. And in this study we are looking at acceptance and commitment therapy as a therapy that can help people who are transitioning into a palliative care phase of having cancer. And so as you can imagine, when people find out that their cancer is no longer curable, it can be a time of a real wide range of different emotions, including denial, including avoidance, distress, upset, worries about telling family how they're going to prepare people, and those kind of things. And so we have reasoned that if we can increase people's psychological flexibility during that time to deal with these really difficult experiences, then that should help them to live more effectively for however long they have left to live. And so what we've been doing is a single case experimental design where we see people individually, we take detailed measures and we sort of follow them through therapy, just a very short course of therapy over about 5 sessions, to see whether this kind of intervention can help them with that transition. So in terms of impact, we really hope that this kind of work can help to infuse the area of palliative care with more structured, evidence-based psychological support. We think palliative care is a particularly good area for this because the staff already have excellent skills, excellent qualities that help them to provide support and care. The ethos and the philosophy often in palliative care also is a great fit. What we're adding to that, we hope, is structure, evidence-based psychological principles. And if our current study proves to be effective, our next steps will be to deliver training to other groups of staff so that they can also use psychological flexibility and acceptance and commitment therapy techniques in their work. In addition, there's good evidence from other groups that when you train people to deliver acceptance and commitment therapy, it also has feedback for the practitioner themselves. This is a model that we see as being relevant to healthcare professionals as well as to the people that we're working with. And so it's also our hope that as we develop this work in this area of palliative care, it will have a knock-on benefit for staff well-being. In terms of postgraduate student projects that I'm able to supervise, one of the themes that we have is that we also do basic measurement studies and laboratory-based studies, some of which go on to then support the applied clinical work that we're doing in terms of designing measures and testing and evaluating measures. also experimental projects where we pick apart clinical interventions and look at the impact of them in a more experimentally controlled kind of way. So some of our current PhD students are doing exactly that kind of project. Some of our master's taught students are also doing that kind of a project. But my program of work is really quite broad, and so what I'm interested in is really any talented PhD or master's student who wants to come and do something that is about really any aspect of human functioning, but explicitly from within a contextual behavioral science, psychological flexibility, acceptance and commitment therapy, or relational frame theory perspective. And so this is a very broad kind of program of work that takes this theoretical orientation and applies it to really any aspect of human functioning. So some of the things that we've also looked into are things like caregiving, successful aging, perspective taking, as well as things that usually are more the thoughts of social psychology, like prejudice, gender inequality, racism and bias.